Acne. It's a problem all women, no matter their age, can relate to. Now, while it may start in our hormonal teenage years, the issue can reappear over and over. I know this. So with us discussing effective ways to manage and control acne, including the more severe forms, is Dr. Sherry Ingraham, a board-certified dermatologist from Advanced Dermatology with multiple offices and locations throughout the greater Houston area. Good morning, doctor.
Hi, thank you for having me.
Thank you so much for being here, because I know this is a topic that a lot of women and teenagers can relate to. So let's just talk real quick, the definition of acne, what it is, what causes it.
Right, so acne is a chronic disorder of the pilosebaceous unit, which is essentially a hair follicle and its associated sebaceous gland. And it can manifest as pimples and papules or comedones, which are what we think of as whiteheads and blackheads on the face, and even cysts and nodules. And it tends to occur in what we call sebaceous areas. So these are the face, the shoulders, the chest, and the back.
And it affects in terms of many different ages, right? It's not just, you think teenagers because of the hormonal changes, puberty, but we're talking from maybe 8 to, who knows, right?
Right. We know that greater than 90% of adolescents get acne, but what we're realizing now is that adult men and women get acne, especially adult females, and we're getting more and more studies showing that adult women are particularly burdened by this disease, and it causes a lot of emotional distress, as you can imagine.
It does, and I've seen it in young girls where it bothers them, and that's where this question comes in. At what point do you think someone with acne should then say, okay, let's get professional help, as opposed to just putting creams and trying this and that?
It's a very good question. You know, we see patients brought into the dermatologist, and we recommend they seek dermatologic care when their acne is inflammatory, when it is severe, because this can lead to scarring. And my job as a dermatologist is absolutely to prevent scarring, and early intervention is key. Also, if they've tried over-the-counter preparations and they aren't getting results, and most importantly, if a parent notices that a child is becoming withdrawn or depressed because of the appearance of their skin, they should seek the care of a dermatologist.
And you hit a good point, because you can go to any drugstore, and there's just a plethora of treatments out there. And I've seen a couple of teenagers that I know, my nephew, for example, who has tried so many things. So what have you found, because you have seen this, you are a pro here, that is an effective way to treat acne so that someone can feel like they're getting the right thing?
So if they have mild acne, what we think of as whiteheads and blackheads, which are comedones,
which is common.
Right. Really, first-line therapy is a topical retinoid and perhaps a topical benzoyl peroxide with a combination topical antibiotic. However, if they're developing severe inflammatory lesions, then we need to think about adding an oral antibiotic such as doxycycline or minocycline. And we give these antibiotics not only to treat the underlying bacteria, but also because of their anti-inflammatory effect. Now, there is a newer product on the market today, which is ACTICLATE, which is a doxycycline Hyclate tablet that I like to use. And the reason I like to use this is because it's a small, easy to swallow tablet. Patients are usually told to absolutely take this with food to avoid an upset stomach. And I also tell patients that it does take several months to see improvement, but what you're going to see is a reduction in those inflammatory lesions, and again, a reduction in the risk of scarring, and this is so important. And that's why we prescribe this class of antibiotics.
And when you've used ACTICLATE with your patients, you've seen a significant change in the treatment?
Yes. An oral antibiotic like ACTICLATE is an essential imperative adjunctive therapy for the treatment of severe acne. Of course, I tell my patients when I'm giving them this antibiotic, it is a tetracycline class of antibiotic. So they do need to be aware of certain things. I can't give it to pregnant women. Children under the age of 8 years of age cannot take this medication. And also, it does have certain side effects we need to be aware of. There is a risk of photosensitivity and a severe sunburn reaction. So, of course, as any dermatologist, I tell them they need to wear their sunscreen, and also they need to take it with a large amount of fluid to avoid esophageal irritation or ulceration.
But in what you've seen in terms of patients taking it, the benefits outweigh maybe the risk?
Oh, absolutely. You know, it's very rare that there's a problem. As long as you educate patients to take this medication, I find compliance is key, and if you're giving them the information, they're able to get this medication and tolerate it because of the limited side effects. They do so well, and it really helps them in the long term combat this ongoing disease.
And let's talk about in terms of, just finances, because sometimes these can be a bit expensive and families just can't afford it. How does this compare?
As a dermatologist, I feel so fortunate because the manufacturers of many of the acne medications which we prescribe now offer coupons to help offset the copays associated with these prescriptions. So with this medication that we're talking about, ACTICLATE, for example, they have a program for eligible patients that makes the medication no more than $10 with each script.
Thank you so much for what you do.
Thank you.
for information where viewers can go and learn more, where would they go, Doctor?
ACTICLATE.com.
ACTICLATE.com. And if you'd like additional information on helping manage severe acne, you can also visit the website, our website, thebalancingact.com, or get social, log on to Facebook /TheBalancing Act fans.